Yesterday, the board was presented with the current health metrics of our county, where we're at 44 cases per 100,000, and we are at a test positivity rate of around 7.5%. We also shared with the board the CDC assembled forecast, which projects that we will not be below the 15 cases per 100,000 threshold that the board set. So based on that information, the superintendent recommended and the board voted 7-1 to delay the return to in-person instruction till March 15th.
MCPS has been greatly appreciative for working with the county health officials on rolling out a vaccination plan for our educators. Our hope is that by the earliest, the end of January, we would be able to begin that process. So we are working, as you know, educators are in Group 1B of the vaccination plan. And so we are working to collect input from various stakeholders on how we can work with the county health officials around the process for vaccination for our staff. And so we will continue to work on that priority list within the system and share that information with our county officials, and they then will follow up to contact staff on the process of vaccination. So we are, again, happy to be able to work with them and support our staff in receiving the vaccination to move forward in this COVID-19 time.
Keep in mind that we have a set of students and families that will be continue in the all virtual environment, and a set of families that are asking for the in-person. And so our goal would be to continue to use the vaccine as yet another way to provide confidence in the safety of students and adults in school buildings. And so we'd want to see enough people get the vaccination so that as we open buildings, that would become very prevalent, that the people who are in the buildings have been vaccinated. And then, it's going to take some time. I believe we have right now one school that has or will open soon as a vaccination site. We have 2 more that the county's asked for. And so there's a lot of work going on around this. At this time, for those individuals under the age of 18, there is no vaccination protocol. And that's been an important conversation. There's been a lot of information out there that I think has confused that conversation. Starting out, it will be adult vaccinations that will be the focus. And then they haven't really given us a time frame for children and adolescents and what will happen with students in the future. But one of our goals is to make sure that one of the ways that we keep our students safe is by working to get the vaccination available to the adults who are front facing, to the adults who are doing the work and have been doing it in the past months and will do it as we open school buildings.